Curious about the impact of ibuprofen on your body? Welcome as you're in for a deep dive. In today's video, we'll explore the journey of ibuprofen through your system, unraveling how it affects your liver, stomach, and kidneys. Before delving into potential side effects, we'll decipher how ibuprofen works and the delicate balance between its benefits and risks. Covering its absorption, therapeutic effects, and considerations for usage, we aim to demystify this commonly used medication. So, health enthusiasts, join us as we dissect the science behind ibuprofen, providing insights into its workings and shedding light on the intricacies of its effects. Let the exploration commence. Ibuprofen, also known as Advil or Motrin, falls under non-steroidal anti-inflammatory drugs. Unlike steroidal anti-inflammatories like prednisone or dexamethasone, which we'll discuss later, ibuprofen serves as a common pain reliever, fever reducer, and anti-inflammatory. It's not the only choice. Alternatives include Aleve or Diproxin, and Voltaren Gel or Diclofenac Gel, each with similar mechanisms. Let's explore how ibuprofen enters the body and its distinctive effects in the body. The process begins by placing the medication in tweezers and tracing its path into the body. Initially entering the oral cavity, commonly referred to as where digestion starts, the pill swiftly moves through the mouth, down the pharynx, and into the esophagus. The esophagus, situated behind the windpipe, guides the tablet's descent, progressing into the stomach. Despite ibuprofen's potential harm to the stomach, the focus is on absorption and its intended effects before delving into possible side effects. Within the stomach, the tablet interacts with gastric juices, including acid, enzymes, and mucus, initiating dissolution and the release of active ingredients. While some absorption occurs in the stomach or bloodstream through the mucosal line, the primary absorption site is the small intestine, rich in blood vessels. The commencement of the breakdown process typically occurs within 30 to 60 minutes, contingent on factors such as stomach contents. Subsequently, as we enter the bloodstream, it can be asserted that the medication will be disseminated throughout the body, after which we can open the discussion on how it exerts its effects. How does ibuprofen help with pain, inflammation, and fever? By blocking enzymes called cyclooxygenase 1 and 2. These enzymes usually make substances called prostaglandins. Prostaglandins are crucial because they play roles in various body processes. They cause inflammation and stimulate pain receptors, especially in areas of infection or damage. Prostaglandins also interact with the hypothalamus in the brain, affecting body temperature and the fever response. In the case of menstrual cramps, prostaglandins make the uterus muscle contract. They even influence blood flow in the kidneys, affecting tiny vessels in the kidney's outer part. Additionally, prostaglandins play a role in the stomach by aiding the mucosal lining in producing mucus and regulating stomach acid. Ibuprofen reduces prostaglandin levels, leading to a decrease in inflammation, relief from pain, and a reduction in fever. Understanding these effects helps us see how ibuprofen as a non-steroidal, anti-inflammatory drug affects various bodily functions, making it useful for different health issues. So if I were to take a medication such as ibuprofen, which inhibits COX-1 and COX-2 enzymes responsible for producing prostaglandins, I would effectively decrease the circulating levels of prostaglandins in the body. Consequently, this reduction could potentially alleviate inflammation, mitigate pain, lower fever, and even alleviate issues like menstrual cramping. Many of you might have experienced varying degrees of success with these medications, depending on the intensity of your pain and the specific conditions affecting your body. However, let's now turn our attention to the potential adverse effects. We'll delve into this topic and find out. We will start with the liver. Could ibuprofen be harmful to the liver? When considering medications like ibuprofen, it's essential to weigh the pros and cons, focusing on the therapeutic benefits versus potential side effects. Let's explore the impact on the liver. The liver, a vital organ located in the upper right abdomen, plays a crucial role in metabolizing drugs. As ibuprofen travels through the bloodstream, it eventually reaches the liver. Here, enzymes in the liver convert ibuprofen into an inactive form, known as a metabolite. This converted ibuprofen then continues through the bloodstream, eventually reaching the kidneys and being eliminated through urine. While there are isolated cases of liver harm from ibuprofen, it is generally considered safe for the liver. However, when compared to potential stomach-related side effects, the story may differ. Moving on to the stomach, ibuprofen can interact with gastric juices, including stomach acid, enzymes, and mucus. This interaction leads to the dissolution of the pill and the release of active ingredients. The majority of absorption occurs in the small intestine, but in the stomach, reducing prostaglandins due to ibuprofen can potentially thin the protective mucus lining. This could make the stomach more vulnerable to irritation, although occasional use may not pose significant risks. Typically, if you use ibuprofen occasionally, like for a few days during flu or illness, you're unlikely to experience significant stomach problems. The real concern arises for those who use ibuprofen daily to manage chronic conditions, such as arthritis. We're particularly attentive to individuals with a history of gastritis, inflammation of the stomach lining, or those with peptic ulcer disease. Daily and prolonged use of ibuprofen in such cases may pose a higher risk of stomach-related issues, and that's where our focus shifts for potential concerns. While ibuprofen is generally safe for the liver, potential side effects related to the stomach require consideration. The balance between the therapeutic benefits and risks associated with the digestive system should guide the use of this medication, with special attention to individual circumstances and medical history. Now, are there other organs affected by ibuprofen? Certainly yes. One of them is the kidney. Let's delve into the details of how ibuprofen may affect the kidneys. As mentioned earlier, ibuprofen, when passing through the liver, transforms into an inactive form known as a metabolite. These metabolites ultimately reach the kidneys and are excreted in urine. Now, exploring this process further, we realize the internal anatomy of the kidneys in a frontal cut. The renal artery, responsible for transporting blood into the kidney, branches out, allowing the distribution of ibuprofen metabolites throughout the kidneys. Moving into the renal cortex, the outer kidney part, we find microscopic blood vessels branching into functional units called nephrons. These nephrons consist of urinary tubules and tiny blood vessels, facilitating the filtration process between the cardiovascular and urinary systems. Waste products, including ibuprofen metabolites, pass into urinary tubules, contributing to the formation of urine. If you would look at a kidney dissection, you would see renal pyramids filled with collecting tubules that gather urine. This urine flows into the renal pelvis, forming the ureter, which leads to the bladder and eventually gets expelled. The continuous process doesn't inherently cause problems in the kidneys. However, a potential side effect arises, not from the outlined process, but rather from the impact on prostaglandins. Going back to the beginning of the video, ibuprofen inhibits enzymes called cyclooxygenase 1 and 2, reducing the production of prostaglandins. Prostaglandins, involved in various physiological processes, also play a role in maintaining kidney function. Despite the intricate process of ibuprofen metabolism and its passage through the kidneys, the primary concern isn't related to these steps. Instead, it revolves around the role of prostaglandins. Prostaglandins, which are like messengers in the body, usually help blood vessels in the kidneys stay open. They act as vasodilators, making sure these tiny blood vessels in the renal cortex stay a bit open. Now, when you take ibuprofen, it interferes with the production of these messengers, the prostaglandins. As a result, the influence to keep those blood vessels open decreases, and they might start to vasoconstrict or narrow. This vasoconstrictive effect isn't a big concern for someone who occasionally takes ibuprofen or uses it for short periods, especially if they stay well hydrated. However, if we consider someone taking it multiple times daily, perhaps to manage arthritis or who already has kidney disease, it could worsen the problem. Let's delve into some general considerations regarding medication use. In medication use, a personalized approach is vital, acknowledging that age, weight, genetics, and overall health impact individual responses. Healthcare providers prioritize tailoring medication plans, ensuring safety and effectiveness based on unique patient characteristics. The start low and go slow principle emphasizes initiating medication at the lowest effective dose. This gradual adjustment minimizes risks and optimizes therapeutic benefits. Both healthcare professionals and individuals managing health with over-the-counter options benefit from this cautious approach. Patient medical history guides medication decisions, with conditions or allergies influencing choices. Open communication about existing health issues is crucial for comprehensive care. Adherence to prescribed regimens is crucial for optimal outcomes. Collaborative efforts between healthcare providers and patients create realistic plans, fostering adherence to prescribed treatments. Beyond prescription medications, consideration of over-the-counter options is essential. These may interact with prescribed medications, requiring careful evaluation. For pregnant or breastfeeding individuals, special considerations are necessary. Healthcare providers weigh medication benefits against potential risks, emphasizing informed decision-making. Environmental and lifestyle factors, including diet, exercise, and exposure to substances, can influence medication effectiveness. A holistic healthcare approach considers these external factors, contributing to a comprehensive understanding of an individual's health profile. What do you think? Share with us in the comments section. Be sure to subscribe and activate the notifications bell. Thank you for watching.